Welcome back to the Score Builders Question and Answer podcast. This podcast provides members of the Score Builders team with the opportunity to explore challenging multiple-choice examination questions with students actively preparing for the licensing examination. Ready? Let's go. A physical therapist plans to perform all 4 upper limb tension tests on a patient. However, they find it difficult to complete ULTT1, median nerve bias, and ULTT4, ulnar nerve bias, due to the patient's limited mobility. Which of the following joint motions is most likely restricted and interfering with these tests? Option 1, shoulder abduction. Option 2, elbow extension. Option 3, forearm pronation. Option 4, wrist flexion. Upper limb tension tests. Upper limb tension tests are neurodynamic tests designed to assess the mechanical sensitivity of peripheral nerves. Each ULTT follows a specific sequence of movements at the shoulder, arm, elbow, forearm, wrist, and hand to progressively load the target nerve. Knowing the specific movement components of each test is essential for both performing them correctly and for answering questions like this one on the exam. This question is a bit different from a typical ULTT question. Rather than asking which test is hardest to perform given a specific restriction, it's working in reverse. We're given 2 tests that are difficult to perform and asked to identify the common movement restriction causing the problem. Let's explore each of the options. Option 1, shoulder abduction. Shoulder abduction is a foundational starting position for both ULTT1 and ULTT4. In ULTT1, the shoulder is abducted to approximately 90 degrees as one of the first key steps in the sequence. In ULTT4, shoulder abduction is similarly required to properly position the arm before adding the remaining components. If a patient has limited shoulder abduction, the therapist simply cannot get the arm into the correct starting position for either test. Option 2, elbow extension. Elbow extension is indeed a component of ULTT1. However, ULTT4 uses elbow flexion, not extension. So if a patient had limited elbow extension, it would interfere with ULTT1, but not ULTT4. Since the question tells us both tests are affected, limited elbow extension cannot be our answer. Option 3, forearm pronation. Forearm pronation is not a critical component of ULTT1, which uses forearm supination instead. As for ULTT4, some resources do suggest forearm pronation as a component, while others suggest supination. Since forearm pronation is clearly not required for ULTT1, it cannot be the movement restriction affecting both tests. Option 4, wrist flexion. Neither ULTT1 nor ULTT4 requires wrist flexion. Both tests utilize wrist extension as part of their movement sequence. So limited wrist flexion would have essentially no impact on either of these tests. This option can be eliminated quickly. So when we look at all 4 options, only shoulder abduction is a critical shared component of both ULTT1 and ULTT4. That's our answer. The correct answer is option 1. Let's explore the all-student data. 70% of students selected option 1, shoulder abduction, the correct response. 13% of students selected option 2, elbow extension. 7% of students selected option 3, forearm pronation. 10% of students selected option 4, wrist flexion. This question is a neuromuscular and nervous systems question which represents approximately 24% of all exam items. This question is a physical therapy examination question which represents approximately 24% of all exam items. This question is a Level 2 question since the question requires students to integrate numerous pieces of information or to apply knowledge in a given clinical scenario. Remediation of Level 2 questions occurs by increasing flexibility with academic content and by carefully analyzing decision-making processes when answering applied examination questions. Looking to review related academic content? Check out page 107 in PT Exam, the complete study guide. Thanks for joining us on the Score Builders Q&A podcast. See you next week.